Hello ma'am, myself Nurja Jokia and I'm studying in TYBPT. In medicine subject, I'm going to present management of pulmonary edema. Before starting management of pulmonary edema, what is pulmonary edema? Pulmonary edema is a life-threatening condition. In pulmonary edema, abnormal accumulation fluid in the alveoli of the lungs. So, abnormal fluid in the lungs. Because of this, there will be no proper exchange of gases. If there will be no proper exchange of gases, so less oxygen in the body, the person will suffer from breathing problem. Pulmonary edema is a condition in which excess fluid collect in the lungs. This makes breathing difficulty because the lungs cannot exchange oxygen properly. The main goal of management are to improve breathing, increase oxygen, remove excess fluid from the lungs. Now, let's start management. During management of pulmonary edema, position is also important. The patient should be placed in sitting position or semi-sitting position. This helps the lungs expand better and reduce fluid accumulation in the lungs and makes breathing easier. So position is important. In semi-sitting and sitting position is important because gravity will pull the extra fluid in the bottom of the lungs and upper region of the lungs there will be clear for exchange of gases. Management number 2, oxygen therapy. Oxygen therapy is also important because abnormal fluid is already accumulated in the lungs, so there is no proper exchange of gases, so there will be less oxygen in the body. So oxygen therapy is also important during management of pulmonary edema. Oxygen is given to increase the oxygen level in the blood. In severe cases, ventilatory support may be required. Management number 3, continuous monitoring. Continuous monitoring is important if the doctor will not continuous monitoring. So, pulmonary edema is a life-threatening condition, so the person will suffer from respiratory failure if the doctor will not continuous monitoring. The patient's condition should be monitored regularly. Vital signs such as blood pressure, pulse rate, respiratory rate, oxygen saturation, temperature. With this, lung sound and breathing pattern should be checked. Management number 4, medications. Medications are given according to the doctor's prescription. Diuretics. Diuretics will help remove excess fluid from the body through the urine. Vasodilators may be used to reduce the workload on the heart and improve blood flow. Other medications may be prescribed depending on the cause of pulmonary edema. Management number 5, fluid and salt restriction. Excess fluid intake should be limited because to prevent further fluid accumulation. If the person is drinking too much water during pulmonary edema, so in the body, total volume of blood will increase in the circulatory system. So heart and kidney they have not access. If heart and kidney is not working properly, so heart and kidney will not access that water, so that water will back up in the lung tissue. That's why fluid is restricted in pulmonary edema. Means fluid, too much amount of fluid is restricted in pulmonary edema. Second one, salt diet is often recommended because excess salt causes the body to retain more water, which can worsen edema. Because salt will attract the water and pulls that water in the blood vessels. So that's why fluid and salt restriction during the management of pulmonary edema. Management number 6, treating the underlying cause. It is important to identify and treat the cause of pulmonary edema. Common causes include heart failure, blood pressure, kidney disease, heart attack, infections. Proper treatment of the underlying condition helps to remove recovery. Management number 7, patient care. The patient should be kept calm and comfortable because anxiety can worsen breathing difficulty. Okay, the person is not able to breathe properly, so that's why so the person will suffer from anxiety. So we have to keep the calm patient, we have to keep the patient calm. The second one, adequate rest should be provided. So here there is an end of presentation. Thank you, ma'am.